As a diabetic, have you ever looked at a menu and wondered, what should I choose? What is the best option for me? Or gone looking for a midnight snack only to stand in front of the open refrigerator, completely perplexed, thinking, what can I eat? Well, I'm going to tell you what a balanced diet looks like. We'll talk about the food pyramid, how your plate should look, and some tools available to help you manage your healthy eating and food challenges. First, it's important to understand that a diabetic diet is not just a diet that is free from sugars. A diabetic meal plan is a balanced, healthy diet. Your body needs a proper balance of the nutrients provided by carbohydrates, protein, fat, water, as well as other vitamins and minerals. Carbohydrates are used as fuel. Your body burns these for energy. Protein helps build and repair muscles, skin, and all other cells. Fats have more calories than anything else, but they also supply energy as well as keep your skin healthy and help transport vitamins. Water is just, essential for life. Vitamins and minerals are needed in small amounts and must come from your food because your body can't make them. The major food groups are shown here in the Diabetes Food Pyramid designed by the American Diabetes Association. In general, the foods of the base and the second layer of the diabetes food pyramid should be consumed liberally, with restriction of the higher layers of the pyramid. The higher the group in the food pyramid, the less your body needs of that specific food group. Grains and starches are at the base of the diabetes food group and consist mainly of carbohydrates like rice, wheat, rye, oat, and our favorite, potatoes. Vegetables are right above the base. They're right above the grains and starches. Vegetables are naturally low in fat content, low in calorie, and rich in vitamins, minerals, fibers, and micronutrients. The fruits are also right above the base of the diabetes food pyramid, right next to the vegetables. Fruits are also rich in vitamins, minerals, fiber, and also carbohydrates. Milk is above the second layer, right above vegetables and fruits. The milk group contains a lot of protein and calcium as well as many vitamins. However, when choosing from the milk category, a diabetic patient should select milk products with low fat content. The meat and other proteins are alongside the milk in the pyramid. The key to choosing your proteins, just like the milk, is looking for the option with the lowest fat content. The fats, oils, sweets, and alcohol are at the very top of the food pyramid, which signifies that very little, if any, of this group should be consumed by diabetics. When putting together a meal, your plate should look like this. Half should be vegetables, a quarter should be carbohydrates, and the last quarter should be your protein. When choosing your beverage, water is always the best option, and sugary drinks should be avoided. One of the things you can do to help manage your healthy eating and deal with food challenges is to keep a food diary. Writing down everything you put in your mouth will help you think twice about what you eat. Another trick is to use a small plate, or split a dessert with someone when going out. Just remember that no one is perfect, and if you mess up one meal, or even a whole day, that doesn't mean tomorrow can't be better. After all, if you fall down one step, are you going to throw yourself down the rest?
When monitoring blood glucose, first you need to understand that diabetes means that you have too much sugar in your blood. High blood sugar problems start when the body no longer makes enough of a hormone called insulin. Insulin is what helps sugar move from your blood into your cells. Without insulin, your cells can't get the sugar they need to keep you healthy. By moving sugar from your blood to your body cells, insulin helps keep your blood sugar level normal. When you don't have enough insulin to lower high blood sugar levels, you have diabetes. Self-monitoring of blood sugar is one of the best ways of knowing how well your diabetes is being managed. A single blood glucose test shows your blood sugar level at the same time it is taken. In this test, blood is drawn and measured before or after a meal. Since blood sugar can vary over the course of the day, a single blood glucose test is not the best way to check for overall control. From testing your blood, you can tell how food, exercise, medications, stress, or illness are affecting your blood sugar. It is also a good indicator if you have signs of very low or high blood sugar. Self-monitoring helps you know if your blood glucose is within the target range. The American Diabetes Association suggests these blood sugar goals for adults with diabetes. The fasting goals include the blood glucose to be between 80 and 120 milligrams per deciliter, and post-meal goals include blood glucose that is less than 170 milligrams per deciliter. Remember, diabetes is a chronic condition that does not go away. Self-monitoring blood glucose is a skill that you will always need to make sure your diabetes is well managed. It gives you the information you and your doctor need to make decisions about your treatment and daily activities in life. Let's get started on the proper way to self-test your blood sugar. If you are unable to test yourself, it is okay to have a healthcare professional help you. Step 1. Get supplies. These include the blood glucose meter, test strips, lancets, the lancing device, and alcohol wipes. Be ready with all the equipment for an accurate blood glucose reading. Step 2. Wash your hands in warm water. Step 3. Load the lancing device with the lancet. Step 4. Wipe the finger you are going to prick with alcohol to remove the initial fatty layer in order to penetrate the finger easier with the lancet. Step 5. Hold the lancet to the side of the fingertip. Step 6. Press the button to stick the finger. Step 7. In order to get a larger amount of blood, squeeze the finger a little lower than where the lancet pierced, but just above the mid-digit. Step 8. Apply the drop of blood to the strip. Step 9. Wait for the meter to show the reading. In Step 10, write your blood sugar in your log after each test. When blood sugar is above normal and becomes high, this is known as hyperglycemia. Watch for these signs and symptoms: extreme thirst, frequent urination, dry skin, hunger, blurred vision, and drowsiness. What you should do if you feel these signs and symptoms: test your blood glucose, and if it is above 200 milligrams per deciliter, call your doctor immediately. You should drink fluids without sugar if you are able to swallow. The causes of hyperglycemia include that there is not enough insulin in the body, possibly you ate too much food, or there could be an infection, fever, illness, or just stress. When blood sugar is below normal and becomes low, this is known as hypoglycemia. Watch for these signs and symptoms: cold sweat, faintness, dizziness, headache, pounding heart, trembling, nervousness, blurred vision, hunger, or irritability. What you should do if you feel these signs and symptoms is to check your blood sugar if possible. Take 2 to 3 glucose tablets or eat foods containing sugar. Drinking an 8-ounce glass of orange juice is a good idea, and then you should wait 15 minutes before rechecking your blood glucose levels. If your blood glucose is still less than 60 milligrams per deciliter, eat a snack with a complex carbohydrate, such as cheese and crackers. The causes of hypoglycemia include too much insulin, possibly not eating enough food, or an unusual amount of exercise, or drinking alcohol without eating food.
So now let us talk about ways to prevent and reduce risk of type 2 diabetes. The first thing you should know is that you should reduce or eliminate alcohol and smoking from your life, because those two have been shown to have a really large correlation of the onset of type 2 diabetes. Next, you should always be sure to go out and do something physically active. Doing exercise 3 times a week can really do your body a lot of good. And what it does is that it makes your tissue cells more sensitive to your body's natural insulin. And that, in its own way, can really help you with avoiding type 2 diabetes. And this doesn't mean that you have to go breaking your back just to stay away from type 2 diabetes. You could do anything, the smallest forms of exercise. It could be a mile run, or maybe half an hour of swimming. Anything that'll keep you active. And another thing that you should be doing is that you should be eating fruits and vegetables. And not only do they keep you from diabetes, but also keep you overall very healthy. They're nutritious. And also stay away from the red meat, particularly those that are processed, such as bacon or hot dogs, because this type of meat has been shown to cause type 2 diabetes. So careful, people, careful. You can also carry a medic alert bracelet, and what that is a bracelet that you'll have around your arm that'll have everything someone will need to know when they see you seizing on the ground. They'll have your emergency contact number, and it'll let them know that you are diabetic, or if you have any other sort of medical condition. And lastly, and most importantly, you should be going to your checkups, and having them answer any questions that you may have, or just making sure that you're overall in really good health.
Foot health is important for everyone. However, a person with diabetes has to be particularly careful with their feet to prevent amputation of the toes or the whole foot. Diabetes can cause a loss of circulation in the lower extremities, which causes a loss of sensation. This can lead to an individual to have sores or ulcers on the bottom of their feet and not be aware of it. The loss of circulation also decreases the body's ability to heal wounds. Because of this, it is necessary for someone with diabetes to perform regular self-assessment of their feet as well as yearly lower extremity amputation prevention or LEAP exams by their primary health provider. This assessment is to assess if the patient is at risk for developing serious foot problems. A LEAP foot screening begins with the visual examination of the feet, including between the toes. This is to look for any sores, ulcers, calluses, athlete's foot, or other abnormalities. Next, a microfilament, which delivers 10 grams of pressure to the patient's foot, is used. It is important to first touch the filament to first your hand, then the patient's hand, to show it will not hurt them. I do not have the appropriate microfilament, so I will demonstrate a LEAP exam with a toothpick on one foot. A real exam would include both feet. There are 12 points in which the foot is touched, and the patient is to say if and when they feel the contact. If after a few tries in the same location, the patient does not respond to the stimuli, it is important to note the result. It is important to stress the importance of daily self-inspection. If they notice a lack of pain or any other abnormality, they should contact their doctor immediately. Another way to prevent future problems is to carefully select footwear. Normal walking in a poor-fitting shoe can lead to a diabetic to have serious problems. A diabetic should never walk barefoot and should avoid heels, boots, shoes with vinyl tops, thongs, narrow-toed shoes, and anything that is too tight or too loose. Specially made diabetic shoes are also available. Any injury, even as simple as dry, cracked skin, should immediately be reported to their primary care provider to assess what can be done to prevent future problems.